Let's talk about the human knee. I mean, it's the largest joint in our entire body. And at first glance, it seems pretty simple, right? It just bends and straightens. But if you look a little closer, you find this absolute biomechanical marvel. It's an amazing solution to a really tough engineering problem. So that's what we're going to dig into today. We're going to unpack that problem and show you the incredible design of the knee.
And yeah, this is the central puzzle of the knee. Think about it. How can this one joint be strong enough to support our entire body weight, letting us stand perfectly still, but also be mobile enough to let us run, jump, pivot, and do everything else? It's this constant battle between stability and mobility, an engineering challenge that evolution just knocked out of the park. So let's break down exactly how it all works.
All right, to really get a handle on the knee, you got to start with its foundation. We're talking about the bones that make up its core structure. Let's literally build this joint from the ground up.
So there are three main bones that come together here. You've got the femur, that's your thigh bone, coming in from the top. Then there's the tibia, your main shin bone, coming up from the bottom. And sitting right out front is the patella, which we all know as the kneecap. Now, you might see the fibula noted on the side there, and that's important because a lot of people think it's part of the knee, but it actually isn't. The fibula connects to the tibia a bit lower down, so it stays out of the main joint action.
So what kind of joint are we looking at? Well, the official name is a modified hinge synovial joint. The hinge part is easy to picture, right? It bends and straightens, flexion and extension, just like a hinge on a door. But that word modified is really, really important because unlike a simple door hinge, the knee also allows for a little bit of rotation, and that small amount of twisting is absolutely crucial for how we move.
And the complexity just keeps going. We talk about the knee as one joint, but it's really three separate points of contact or articulations all wrapped up in one package. You've got two connections between your thigh bone and your shin bone. Those are the tibiofemoral joints. And then you have a third one, the patellofemoral joint. That's where your kneecap glides along the femur. It's this whole three-part system that gives the knee its incredible range of motion. Okay, so the bones give us the frame, but they're just, well, bones. They can't do this job all by themselves. Now we need to bring in the soft tissues, these incredible structures that act like cushions and high-tension support cables, giving the knee all its stability. First up, meet the menisci. These are two little crescent-shaped pads of cartilage that sit right between the femur and the tibia, and they are the knee's master shock absorbers. They spread our body weight out evenly and basically help the bones fit together perfectly. The one on the inside, the medial meniscus, is C-shaped and doesn't move around a lot, which unfortunately also makes it easier to injure. The one on the outside, the lateral meniscus, is more O-shaped and has a bit more wiggle room. All right, next up, the ligaments. These are the knee's tough, fibrous support cables. It's easiest to think of them in two groups. First, on the sides of the knee, you have the collateral ligaments, the MCL and LCL. They're like walls, stopping your knee from buckling from side to side. Then, deep inside the joint, you have the cruciate ligaments, the ACL and PCL. They get their name because they cross over each other in a distinct X shape, and their main job is to stop your shin bone from sliding too far forward or backward. Let's zoom in on those cruciates for a second because they're so important. As you can see here, the anterior cruciate ligament, or ACL, is the one that stops the tibia from sliding forward. This is the one you always hear about in sports injuries, right? But its partner, the posterior cruciate ligament, or PCL, stops the tibia from moving backward. And here's a fun fact. The PCL is actually the strongest ligament in the entire knee. It's way thicker and stronger than the more famous ACL. Okay, we've got the frame and the support cables. We've covered all the static parts that hold it together. But how does this thing actually move? For that, we need to bring in the engine, the muscles. Let's see how they create a dynamic system. Movement really comes down to this constant push and pull between two huge opposing muscle groups. On the front of your thigh, you've got the quadriceps. This is a massive group of 4 muscles, and they're the only ones that extend or straighten the knee. When they contract, they pull that lower leg forward. Then, on the back of your thigh, you have the hamstrings. They do the opposite job. They're the primary flexors, contracting to pull the lower leg back and bend the knee. This is the engine behind every single step you take. So where does that little kneecap, the patella, fit into all this? Well, this quote explains it perfectly. The patella acts just like a pulley. It sits inside that big quadriceps tendon and actually moves it slightly farther away from the knee's center of rotation. This gives the quads much better leverage, increasing their power and making it way more efficient to straighten your leg. In fact, without the patella, our quads would have to work about 30% harder.
Now, the knee has one last amazing trick up its sleeve for stability. It's called the screw-home mechanism. As you stand up and fully straighten your leg, right in those last few degrees of extension, your tibia automatically rotates just a little bit outwards. This motion literally screws the joint tight, locking the bones together into this super stable position. It's what lets us stand for a long time without using a ton of muscle energy. And to bend your knee again, a tiny muscle has to fire first, just to unlock it.
So, we've seen how the knee is this brilliant mix of stability and motion. But what happens when the forces are just too much and that amazing system fails? Let's dive into what happens when things go wrong. The knee's design is incredible, but that same complexity also makes it vulnerable, especially during sports. Sudden stops, twists, or hyperextension can just push the joint past its breaking point. And as this quote points out, the most famous victim of these forces is almost always the anterior cruciate ligament, the ACL. Let's break down a few of the most common injuries. An ACL tear, usually from a quick pivot or a bad landing, creates that horrible feeling of instability, like your knee is just giving way. A meniscal tear often happens when you twist on a planted foot, and that can cause pain, clicking, or even locking of the joint. And then you have the really nasty one, the unhappy triad. This happens from a big blow to the outside of the knee, and it can tear the ACL, the MCL, and the medial meniscus all at the same time. So, when a doctor or a physio suspects a ligament is torn, what are they actually looking for? It's something called joint laxity. And all that means is there's excessive abnormal movement in the joint. For example, a classic test is to gently pull the shin bone forward. If it moves too much, that shows the instability that points to a torn ACL. It's a direct sign that those static support cables we talked about have failed. So if there's one thing to take away from all of this, it's this. A healthy knee is all about partnership. It needs the static stability from its ligaments and bone shape, working in perfect harmony with the dynamic stability that comes from the muscles around it. If one part is weak or injured, the other has to work that much harder to pick up the slack. This delicate balance is the absolute key to performance and to staying injury-free. And all of this leaves us with a pretty big question for the future. As athletes push their bodies harder than ever, and as all of us expect to live longer, more active lives, the demands on our knees are just going to keep increasing. So how will our understanding of this biomechanical marvel change the future of knee surgery, rehab, and injury prevention? It's a fascinating challenge, and one that science is working on every single day. Thanks so much for joining me.